Did you wake up with just a pain on your cheek, or have you been told you need a root canal? I'm Dr. Miro, and I'm a dentist here at Implant and Aesthetic Specialists. And today we're going to talk about what is a root canal and what exactly does that process look like. I always like to tell patients a root canal is basically like a filling, but what we're doing is we're filling the inside of the tooth. A lot of people don't know this, but your tooth actually has a nerve and it has blood that actually goes to it. The root canal procedure might sound a little bit scary, but it actually is really simple. Basically what we do is we drill a little hole through the tooth, the access, the area that we get in there, and we can really clean out that nerve of the tooth and the blood supply so we can fill it up with a putty material. When we clean it out for you, we use a lot of different types of liquids and irrigations, which really make sure that any bacteria that was in that tooth that was causing you pain is cleaned out from the tooth. After that, we go ahead and we fill the area of the tooth that we cleaned out for you. Make sure that it's filled all the way to the top, nice and comfortably. One thing that I like to tell patients is that's really important after a root canal is after a root canal, your tooth needs a crown. What is a crown? A crown is a structure that's going to protect your tooth 360 degrees of the tooth. Some patients ask, well, I just got my root canal, why do I need a crown now? So I always like to explain to them, when you clean out the inside of something, you make it hollow. Therefore, you can weaken the tooth some. Even though we need these root canals to take us out of pain, it does weaken your tooth a little bit. These crowns are there to protect the tooth. We put them over the tooth 360 degrees so that your tooth can function as one unit. All in all, root canals really aim to remove all of the infected tissue from your tooth and fill it with the synthetic material so that you will no longer experience pain or symptoms on this tooth. This is really aimed to remove any pain or infection from your tooth, making it nice and clean. If you think you might need a root canal, but you don't know exactly, you haven't been told by a dentist, definitely go in and consult a dentist. There's a lot of things that can happen that can lead to us needing a root canal. Some of these things can be you break the tooth and it's broken all the way down to where that little nerve supply was to the tooth. This can cause a lot of pain. Other things can be you have a cavity and unfortunately the cavity just gets big enough that it touches the nerve of the tooth. Really, those are the two main things, but one other thing is sometimes if you fall or you hit your tooth, bite down on something really hard, this can actually cause enough trauma to a tooth that could cause you to need a root canal. That root canal pain usually is a throbbing kind of heartbeat sensation on the tooth, and we always want to address it as soon as patients start to experience symptoms to assure that they don't progress and to assure that patients don't develop any sort of infection on that tooth. Besides heartbeat pain on that tooth, another thing that could be an indicator of needing a root canal, if you can't just see it because the tooth has a cavity or it's broken, it could be like lots of hot and cold sensitivity. You just drink that ice water and the pain shoots you through your chair. That's indicative that something might be going on with the nerve of that tooth, and it's really essential to go see your doctor and make sure that it's addressed. A root canal is definitely something you don't want to delay. If you need one, please go see your dentist. Come see us. We're happy to help you. It's something that you want to avoid progressing. If you've been told you need a root canal or you think you might need a root canal, come see us. We're happy to help you. I'm Dr. Miro, and I'm a dentist here at Implant and Aesthetic Specialists, and I'm here to help you watch your mouth.